Bladder 31 is within the first sacral foramen. Bladder 32 is within the second sacral foramen. Bladder 33 within the third sacral foramen, and bladder 34 within the fourth sacral foramen.
Large intestine 15 is located anterior and inferior to the acromion process at the origin of the deltoid muscles. The easiest way to find this point is to take the weight of the person's arm, extend their arm, and palpate for the clefts between the anterior, lateral and posterior heads of the deltoid. If you push medially, you should be able to feel the bony extremity of the acromion process. You need to locate this point inferior to the acromion process between the anterior and lateral heads of the muscle. Mark this point when the arm is then relaxed. Sanjiao 15 is located in the suprascapular fossa. It's halfway between Do 14 at the base of C7 and the lateral extremity of the acromion. It's also located halfway between gallbladder 21 and small intestine 13. Gallbladder 21 is located midway between Do 14 at the base of C7 and the lateral extremity of the acromion process, but at the crest of the trapezius muscle. To find the crest of the muscle, it may be necessary to dip down slightly to make sure you get the highest part. This point forms a line with Sanjiao 15 and small intestine 13. Gallbladder 21. Sanjiao points on the forearm are best located with the arm laying flat on the bed and the elbow turned outwards. To find Sanjiao 5, come 2 sun proximal to Sanjiao 4 in between the radius and the ulna. You should be on the radial side of the tendon of extensor digitorum communis. If the person wiggles their fingers, this tendon will come into relief.
Sanjiao 10 is located 1 sun superior to the tip of the olecranon process of the elbow. The point is found with the arm flexed and the hand supinated.
Large intestine 11 is located at the midpoint between lung 5 and the prominence of the lateral epicondyle of the humerus. Typically, this is at the end of the transverse cubital crease when the arm is fully flexed. Lung 5 is located on the transverse cubital crease in a depression which is just radial to the aponeurosis of biceps brachii. This point has a nice, soft, swampy feel to it. Be careful to not go too radial and to fall onto the tendon of brachioradialis.
Lung 11 is at the radial nail point of the thumb. So in order to find that point, I'm going to look at where the proximal and radial borders of the nail meet. I'm going to look at the nail bed, feel for where the flare of the bone is, and put my point in. Pericardium 6 is on the flexor aspect of the forearm. It's 2 cm proximal from pericardium 7, and it's in between the 2 tendons palmaris longus and flexor carpi radialis.
The easiest way to locate liver 8 is to fully flex the leg, place your finger on the medial end of the popliteal crease, open the leg up to 90 degrees and then travel slightly superiorly, that's up towards the head, a very small distance until you fall into a nice dip that is anterior to the tendons of semitendinosus and semimembranosus. It's about 1 cm anterior to kidney 10. Spleen 5 is located in a depression which is anterior and inferior to the medial malleolus. Trace along the anterior border of the malleolus and the inferior border, and then palpate whilst you articulate the foot. Feel for a nice dip. Spleen 5 is in that dip.
Gallbladder 30 is in the posterior lateral aspect of the hip. It's at a junction from the anterior 1/3 and posterior 2/3 of a line taken from the prominence of the greater trochanter and the sacral hiatus.
Gallbladder 34 is located in a depression which is anterior and inferior to the head of the fibula. To locate the head of the fibula, find the tibial tuberosity and move laterally until you find a prominent bony landmark. Be sure that you don't confuse the head of the fibula with the lateral condyle of the tibia, which is closer to the kneecap. Gallbladder 41 is located on the dorsum of the foot in a depression distal to the junction of the bases of the 4th and 5th metatarsals. If you articulate the 2 metatarsals, you'll be able to feel a nice groove in between their shafts. Gallbladder 41 is located lateral to the tendon of extensor digitorum longus, little toe branch. If you extend the toe, this will bring this tendon into relief. The easiest way to find spleen 9 is to palpate gently up the medial crest of the tibia until you fall into a nice depression formed by the medial crest of the tibia and the inferior border of the tibial condyle. This point's in a depression. It's not on bone, it's not on muscle. It's in a tender depression. Stomach 42 is located on the dorsum of the foot between the 2nd and 3rd metatarsals and the cuneiform bones. It's approximately 1.5 cm proximal to stomach 43. In some people, when they point their foot and pull up their toes, a nice depression appears here.